Hello, my name's Dr. Gomez. I'm a cardiologist who specialises in heart rhythm problems, and today I'll be speaking about a new technology which has become available for patients who require a permanent pacemaker. This is a leadless permanent pacemaker. Leadless permanent pacemakers are not suitable for all patients requiring a pacemaker, and this decision about this type of pacemaker is best made by a cardiologist or heart rhythm specialist such as myself. A discussion about pacemakers is best started with a look at the heart itself, including its structure and the function of the heart's electrical system. So I'll draw your attention to this model here, which shows all four chambers of the heart. There's the two top chambers, which are the atria, right and left, and the ventricles, right and left. The ventricles are the pumps that squeeze blood out to the rest of the body. The whole heart is controlled by an electrical system. I'll draw in this electrical system on a rough diagram here. This shows the heart and the four chambers. There are the top chambers, the atria, and the bottom chambers, the ventricle. All four chambers are controlled by an electrical system. There's a spark plug or sinus node, if we think of it like the spark plug in your car at the top of the heart. There's the AV node, which is like a fuse box, and there are two wires feeding the bottom of the heart. Some people can develop a slow pulse and a disturbance to the normal heart rhythm, which would be activation of the top of the heart and messages travelling down through the middle to the bottom of the heart. Top, bottom would be a normal heart rhythm. And I'll draw that over here where we see the top of the heartbeat, bottom of the heartbeat, top and bottom. This is called normal sinus rhythm, where messages start at the top, then the bottom, top and the bottom. And this is what we see on a cardiograph in patients with normal rhythm. When the heart is functioning in this way and the rhythm is not slow, we wouldn't expect any symptoms at all. Various heart rhythm disturbances can occur resulting in a slow pulse. In patients with a slow pulse and symptoms related to that, which would be typically lightheadedness, dizziness or blackouts, a permanent pacemaker can be considered. Traditional permanent pacemaker implantation and the risks associated with that procedure are discussed elsewhere on this website. I will discuss particularly this new technology, which is a leadless pacemaker. As I said, the traditional pacemaker procedure is discussed elsewhere, and this is a pacemaker generator, a traditional pacemaker generator, which involves wires placed from a battery here. This is the generator, and wires are placed from the battery which attach to the different parts of the heart's electrical system in order to provide support. These wires, one or two wires attached to a battery, and those wires are attached to a battery which would sit under the skin, under the collarbone, and need to be replaced every 8 to 10 years. Only patients at this stage with a single wire pacemaker to the bottom of the heart are candidates for this new type of technology, which is the leadless pacemaker. We'll discuss the leadless pacemaker now, including the procedure itself and the risks involved in some detail. I'll show you firstly the leadless pacemaker. This is the device that's most commonly used in Australia currently. As I said, it is a new technology. It's only been implanted in patients routinely over the last couple of years. But there are now thousands of patients who have had this type of pacemaker implanted safely and effectively. So we know that this new technology is safe and effective. What is involved to implant this type of pacemaker involves getting access into the vein at the top of the leg, the femoral vein. A tube is passed from the femoral vein up into the right ventricle. Through that tube, this pacemaker is delivered, and we aim to implant this pacemaker in the same place that a traditional pacemaker wire is placed, in the area at the bottom of the heart on the right side, the right ventricle. This pacemaker is implanted into the pacemaker, and you can see these tiny little hooks at the end of the battery here. Those hooks will allow the pacemaker to stay in place inside the heart by embedding into the heart muscle tissue. Testing's performed of the pacemaker to make sure that it can see the underlying heart activity and also stimulate or pace the heart. And providing that is present, and we see that the hooks are in place inside the heart, this tube at the top of the leg is removed, and then patients typically would travel home the following day after the procedure. This battery does not, unlike a traditional pacemaker, get replaced. So this type of battery will stay and function. Typically, for a usual amount, the pacemaker will work in most patients between 8 to 10 years. At the end of that period, if this technology is used again, a new leadless pacemaker will need to be inserted at that time. We would expect, based on technological advances, that in 8 to 10 years this type of battery will be smaller, but we can't guarantee that. In terms of risks associated with the leadless pacemaker implantation, that would include bleeding, infection, blood clots, and damage to the surrounding blood vessels and nerves at the top of the leg where this tube is placed. There is a chance of damaging the heart, causing bleeding around the heart. There's the chance of heart attack or stroke. There is a special risk in this procedure of the device itself, of this pacemaker, coming away from the heart and travelling to other parts of the body. Typically, the risk would be of the pacemaker coming away and travelling away into the lungs. Rarely patients can have a hole in the heart, and if the hole in the heart was large, it could travel to other parts of the body, but this would be a very, very unusual occurrence. There have been cases of pacemaker dislodgement, and in most cases, the leadless pacemaker has been able to be recovered using special techniques from the groin. This procedure is not, as I said, for all patients requiring permanent pacemaker. It's a new technology, and it is a potential technology or procedure used for some patients who require a permanent pacemaker. I'm happy to meet to discuss this procedure in further detail, should you wish. Thank you.